So welcome to the Medicines Management Legislations session for PW1002. In this session I'm going to follow on some of the discussions that we had in the morning session, in the introductory session, and I'm going to introduce your tasks. So hopefully it should be quite an interesting session for you. Obviously we are going to look at legislations today, so rather than me actually sit here and go through the legislations, which I know, we're all sat at home in our nice warm houses with our brews, it's not exactly going to be the most thrilling session. So I've organised some tasks for us to do, for you to actually use the resources and things that I've put together, so you can actually look at these legislations yourself and actually look at how they apply to different situations. So the aims and learning outcomes for the session, we're going to be able to identify some of the legislation that governs the use of medicines in different health and social care settings, and we're going to be able to outline the legal classification system for different medicines. And when we think about our general overview and think about, what we introduced this morning, looking at the overall learning outcomes for the module, these are going to relate to learning outcomes 2 and 4 for our particular module. So what is medicines management? Obviously, I did a brief introduction this morning. I looked at, some of the thoughts behind meds management. I looked at some of the ideas of what we were going to cover in the module and how we were going to achieve this. But when we're thinking about medicines management is referred to sometimes as medicines optimization. And it has been defined by the Medicines and Healthcare Products Regulatory Agency in 2004 as the clinical, cost-effective and safe use of medicines to ensure that patients get the maximum benefit from the medicines that they need, while at the same time minimising potential harm. So when we're thinking about medicines management, it's not just the fact that a prescriber has said, oh, this is what's wrong with you and these are the medications that you need to take. It's actually a very tight balancing act between the medication that is going to be prescribed for the condition and the condition itself. So it's quite hard sometimes for prescribers to actually look at, is it in the patient's best interest to give them the medication? If it is in the patient's best interest, what are the potential side effects or problems from this? And are they actually worse than the original disease or illness that these medications are actually out to help? There's quite a lot of contemporary thoughts about different medications and things. I mean, if you've been listening to the news or looking at anything at the minute about the design and kind of production of the new vaccine that they're hopefully going to be able to bring about for COVID, it's very hard. Somebody's once saying, oh yeah, we've got it, and then it's, oh no, actually we haven't, because it's got these side effects or it doesn't actually work. And it's looking at the process and thinking about everything that goes when we're actually trying to bring medications and products into the kind of public sector so that we can be prescribed them or we can take them. And it's looking at which medications are actually classified as these ones that are safe, that actually we don't need to regulate in the same manner, so we can sell them on the shelves of Asda or Tesco's or the Spar shop. And actually these ones have got to be really, really closely monitored. So these have to be prescribed and managed by a particular GP, consultant, doctor, specialist, whomever it is. So it's actually a really, really tough balancing act. And then, of course, like anything, we have to bring in and think about the cost. These medications might be absolutely amazing, but actually, if a medication or a particular tablet is actually extremely costly, excuse me, you've got to think about the benefits for the patient and benefits that if you didn't prescribe a particular medication to a patient for other patients. If one patient's medication costs are going to be in the thousands or hundreds of thousands sometimes, we can all sit at home and think, oh, well, why isn't that patient being prescribed something if it could potentially cure them or extend their life? However, as everything within the health service, we've also got to think about, You know, what are the positives and negatives of this? If we use a massive chunk of that particular agency's funding for one patient, how many other patients might miss out? So it is actually a really, really hard balance, because it is the balance between the clinical, the cost, and the safety for the patients. So effective medicines management places the patient as the primary focus, therefore delivering better targeted care with better informed individuals. And this is really why you're on this module. You know, like I said in the introductory session, and like we obviously discussed this morning, you know, you might not be directly involved in the prescription or the admittance of particular medications. However, it's about being informed. It's about having the knowledge and the understanding to actually support our patients, to enable patient-centred care, and to help our patients get the best out of their medicines management. So what we've done for this, because as I said, legislations, if you all sat and listened to me whitter on about legislations, you'd all be asleep or you'd have fast forwarded through that section. What I've actually done is, on the class notebook that obviously I've talked you through this morning, I have a particular section. So as you can see over here, you can see on this meds management section just here, within week 1, we've got PowerPoint links, we've got the week 1 tasks. So these are what I'm going to go through and show you now. But on this meds management resources page lower down, I've put a selection of links and a selection of resources that you might think that are useful to help you go through the different legislations and the different things that you might need to actually help you answer the task questions today. So as we're saying, so if you just click on these pictures, click on the Department of Health, the Healthcare Professionals Council, or the Royal College of Nursing, that will take you directly to their medicines management sections on these websites, so you can actually help and see what's needed and how you're actually going to go ahead and look at those research and things. You've also got here 3 links to PDF articles that are also going to be needed specifically to be able to click on them to link again to look at the legislations and the different resources that are on there. I've also put a bit of a link to the library search, because again, just because we've got online resources doesn't mean that you can't use some of the online library search resources to actually look for medicines management and other things that are going to help you with these particular tasks. So hopefully that's a really good resource on there that's going to help you, that you've got plenty of things to click on, plenty of things to be exploring that are going to take you on to further resources to help you with these particular tasks. And I'm sure, as I mentioned earlier, that on this articles little section here, you've also got a link to a couple of articles from the Nursing Times that you might find quite helpful to help you with understanding medicines management and thinking about that in a little bit more detail. So for your first task, we've got to find 2 national legislation documents that govern the use of medicines in the UK. Now, as I said, on those resources tabs, you've got an awful lot of things that you can read, things that you can look through that are going to help you understand 2 national legislations, so that you can actually say, these are the ones, find them, and then pick 2 of the different legislations and then consider and think about, how do these relate to your practice? So as I keep saying, you know, I'm not saying that you should be prescribing medications or that you should be administering medications, but think about some of the information that's within these documents. You know, are we talking about having a knowledge? Are we talking about having an understanding? Are we talking about being able to support patients who are taking medications? So there might be lots of different things that you do within your practice that can help and can support, but it isn't direct administration or prescribing. So look through those legislations and think about your role, think about your practice and what you actually do. So the second task is to find the document that governs the legal classification of drugs. So this is going to have the same things as like Class A, Class B, Class C, but we're also looking for, when we think about our medications, think about the different classifications. So is it something that we need to get on prescription? Is it something which is on a general sales list? So can we buy it in a supermarket or in a shop? Or is it something that you can buy from a pharmacy, but it doesn't necessarily need to be prescribed? But it does need to have that discussion about, is it the right medication for you? Is it the best thing? Now, some of these things you might actually be able to know off the top of your head. Other of these things you might have to go away and do some more research. And as I've said on some of the other resource note pages on the notebook, I've also got links to the online BNF. You might have downloaded the BNF app. You might have a physical BNF that you can have a look in. So it might be that you want to go straight to the BNF and to have a look and have a read about these. Or it might be that you want to, look at the different classifications, what the general sales list is, what prescription only is, what pharmacy is, so that you can fully understand them. So some of the medications on here are going to be our friends over the rest of this module. As I said in the introduction, we're only going to be looking at specific medications for this module. You do have an exam coming up, you do have to think about that. So rather than just going, okay, you've got to learn the whole BNF, which I think nobody would want to come back to my second session, what I've done is we've looked at some key medications from different groupings, and so these are really the medications that are going to be our friends across the rest of the module. And again, I won't expect you to know everything and anything about it, but when I'm thinking about our exam, you might get a question that says, which of these are on the general sales list, and then it might list 4 different medications, and then you'd have to know which was on the general sales list, but it would have been one of the ones that's either on our list and the ones that we've looked at within our different sessions. And then our last task is kind of taking that forward from there. And what I need you to do is I need you to think about, okay, so we've looked at prescription only, we've looked at pharmacy, we've looked at the general sales list. So not thinking about the medications that we've already identified in task 2, what medications are actually going to be helpful and how we can actually research some other medications. So as it said, can we think about 2 other examples of medications which would come under each of the different classifications? So again, you might have some ideas off the top of your head. It might be that you can think about the ones that you can go and buy at the supermarket. You might have had dealings with different medications before that you can think of, oh, these are prescription only. These are ones that I bought from the pharmacy, but I can't buy from the supermarket. So have a think about different medications and think about any examples that you can think of that are about prescription only, over-the-counter or pharmacy drugs, or off the general sales list. Now obviously these tasks we're going to discuss in our session, in our seminar in the afternoon. So make sure that you've uploaded your examples into your folder on the Teams page within our channel, so that you can look at your work, so that you've got access to your notes and things, but also make sure that you've got a copy or you've got access to them, because we will be having a bit of a chat about these in our seminar in the afternoon. And then lastly but not leastly, there I am again. So if you've got any questions, again, any questions you can pop on the Teams page. Obviously everybody can have a discussion there. We can all, answer, help, support, guide. You can email me, you can direct message me on Teams, or you can save them, and obviously in the afternoon session, in the seminar, we'll have a chat and we can bring up any questions, anything that you're not 100% sure about, or any thoughts that you might have about how this actually refers to your practice, or what you're thinking about the different legislations and the different things that you've actually looked at today. So I hope that's all right. I'll see you in the seminar this afternoon. Enjoy the tasks and I shall catch up with you later. Bye.